Hi, my name's Greg, and I'm a Reiki practitioner at Roswell Park in the Wellness Center. And I just want to explain to you a little bit about Reiki and how it began over 2,500 years ago, which is an ancient Japanese relaxation technique. And what we found here at Roswell is that it helps establish an energetic balance to the patient. And in the process of administering the Reiki, patients have less nausea, they have a better appetite, they have a better quality of life, they can release some tension and stress in the process of that. And it's a complement to the treatment that they're receiving here at Roswell. It's not a replacement for it, but a complement to it. And now we'll give a brief demonstration on what you can expect when you come for a Reiki session here at Roswell. As we begin our session, I ask the client if they would like light touch or no touch. Reiki can be administered either way. However, it is more effective in the transmission of the healing energy in a light touch position. And in doing so, we begin with is to ground the client at her feet position and ask them to just begin with some deep breaths. And I also will then encourage them to try to visualize that there are roots growing out of the bottom of their feet and that they are extending into the earth. It is giving them a stronger foundation, strong nourishment, strong connection, and stability. I can then move from the feet position and I'll move up to the knees, because now the energy is going to start to work up the body in this regard. And I'll spend a couple of minutes in this position, and then from there, from the knee to the hip. A lot of times I've found that people will comment that, oh, I have a sore hip, thank you for that. That released some discomfort that I've had. A lot of times the hip seems to be an area in which there's an emotional release or physical pain release. From there, I then connect to the hand. Again, we're drawing energy up into the body this way, and then to the shoulder area. And then as I work my way around to the head, I will then go to both shoulders and then to the temples. I've had a number of people tell me that they had come in with headaches, and after leaving the session, their headaches went away. And there seems to be some value in the fact that the energy is balancing the left and the right side of the brain. Working my way back down, we also focus on the chakras. So we try to restore balance to the chakras. And again, never violating the client's personal space. We don't use any touch on the center of the body whatsoever, but hover the hand over it, because we still can send energy to those energy centers. We then just reverse the hand positions that we did on the left side of the body. Again, the shoulder to the hand, to the wrist, to the elbow, and then we proceed down to the waist, to the hip bone and the knee. And I'm sort of abbreviating the length of time that I spend at each position, because the overall session is 20 minutes. And in some cases we run longer. We take each individual session into consideration and how the patient is responding. And then from there, down to the knee and the foot area. And then we conclude at the feet again to ground the patient. And then one other technique that we use is we want to, because we've worked in their chakra area before we dismiss them, after we ground them, what we do is we smooth their chakras out. So in other words, I go over, and as I move toward the head, we will then just smooth the chakra area out, because we've been sending energy into that center of the body. Sometimes it may take a minute or two before they open their eyes if they've fallen asleep or been in a dream state. If you would like to attend a Reiki session here at Roswell Park, they're available on Tuesdays and Thursdays from 11 until 2 in the first floor of the cafeteria just past the registers. These sessions are open for patients, caregivers, and staff.